Okay guys, hip extension class, but we're also going to go through some hip extension bases. It's really important that we get into the right base for you, that you're finding the line of tension, but sometimes this one can be a little bit difficult because of pressure on the knee. So let's go through different ways that we can set up these bases and hip extension, and then we're going to get into the class. So if you know your hip extension base, just fast forward a little bit to the start of our class when we start doing our hip controlled articular rotations, and then we'll get into it. Okay, hip extension base, using a wall, yoga mat, knee cushion to protect the knee. Get into our hip extension here, and what we want to do is posterior pelvic tilt, find the line of tension. Using the wall to balance, this would be our position for our 2-minute stretch. To increase that stretch, we can use some blocks. Work out what that block height works with you. Again, posterior pelvic tilt, find the line of tension, okay? Sometimes if you bring the blocks out so that your hip can get more in internal rotation, that helps get the line of tension in a different part of that joint capsule and anterior tissues there. So give that one a go, see how that feels. Okay, hip extension base on all fours. The important movement for this is posterior pelvic tilt. So we want to decrease that lumbar curve, go into posterior pelvic tilt. This is anterior pelvic tilt, but we're trying to increase the lumbar curve. Okay, find some blocks and the block height that will suit you. We're going on all fours, placing our knee on the blocks, finding that line of tension and stretch. We do that by posterior pelvic tilting, altering where this leg is to just go deeper into the stretch, but really important to maintain that posterior pelvic tilt to help limit any compensations through our spine. So this would be the position. Our PAILs contraction will be pushing down into the blocks and scooping forward. Our RAILs contraction will be donkey kicking, trying to make our knee lighter off the blocks. We can modify this by going on to our elbows. So this one, remember, going to posterior pelvic tilt and finding the line of tension in this position. So try those out, see if that feels comfortable, making sure that you're getting that line of tension. Okay, hip extension. This is for those that struggle with pressure on their knee, they have a knee replacement or whatever. We want to place about 3 or 4 blocks on this side of the yoga mat. We're going to be stretching our left hip for this one. We're going to be side lying in the lunge position. So I like to get nice and close to the wall, so my knee can touch the wall, placing my ankle and foot on the blocks to rest that over there. And then it's just trying to find the position. Now, what's important for this is posterior pelvic tilt. So get into posterior pelvic tilt and then find the line of tension. You may have to move and position yourself so that you can find the line of tension through this left hip and into that front of the hip there. So breathe in, irradiate, posterior pelvic tilt, find that line of tension. Now the PAILs contraction is going to be pushing and scooping into the wall. Our RAILs contraction is trying to make our foot lighter off the wall in a donkey kick kind of position. And that is the position. So you can give that one a go, especially if you have problems with pressure on the knee, getting into these extension bases. Okay, hip extension stretch using a wall, cushion for our knee, getting into that lunge position. Depending on how far you are from the wall, depend on the intensity of the stretch. And again, we are posterior pelvic tilting and then find our line of tension. We can internally rotate the hip to get different lines of tension. Externally rotating the hip, you just find the line of tension that best suits you. And what we want to do with our PAILs contraction, we're driving and scooping forward into hip flexion. And then for our PAILs contraction, our RAILs contraction, we're trying to donkey kick into the wall. Great. So we've gone through different bases that we can use for hip extension. So let's get into the class. Okay, let's warm up with hip CARs. If you don't understand how to do this, please go into previous videos of how to do our hip CARs. We can do this in different positions. Today, we're gonna do this in a standing position. Again, breathe in, irradiate. Really important that we do that. We create full body tension. And then what we wanna do is go into hip flexion. Come up as far as we can. Now we abduct. We kind of create the biggest circle possible. Then we come into internal rotation and we extend back as far as we can in extension and back into that neutral position. We don't want to be compensating through our spine. We just want to be working that focus joint, our hip joint. Then we come back, we extend, find our roadblock, then we external rotate. We fight for external rotation, going back down into that neutral position. Let's do this from the side. So breathe in and irradiate, come into flexion. We go abduction. Now we start to internally rotate, fight for internal rotation. Keep fighting for that internal rotation as we extend back. Slow and controlled in the pain-free range. Neutral position, now we're coming back into extension, find our roadblock, then we go into external rotation, fight for external rotation, biggest circle possible, and come back down into that neutral position. Okay, let's do 4 reps on each side. So breathe in and irradiate. We're searching for the best possible movement, the movement that we have ownership over, and active motor control over. Slow and controlled, pain-free range. This gives us a baseline of our hip mobility and where we're at and what we need to work on. It also helps, gives the nervous system information, gives nutrients to the joint, helps us maintain our range of motion, and helps us to have that active control in our outer range, opening up more mobility health. And last one. So going into our last one, internally rotate, fight for internal rotation, and then we come up into extension, coming around. Fantastic. Okay, let's do the other side. 4 reps, breathe in and irradiate, coming up into hip flexion, abduction, internal rotate. Good. Extend, externally rotate, coming up. Try not to compensate with other parts of the body. Slow and controlled. Great, amazing. Okay, let's get into our hip extension base on all 4s. We really want to be focusing on that posterior pelvic tilt for this one. I'm going to be using 3 blocks, getting into my base, posterior pelvic tilt, and then I want to start my timer. So it's really important that we get at least a 2-minute stretch here. That allows adaptation and re-education of tissues. We get creep through our connective tissue, and we're getting the information that the cells need to make change. Maintaining that posterior pelvic tilt. This is where we do our breath work. We want to get into that rest and digest by doing our breath work, because stretching is very sympathetic, fight or flight. So we want to get rid of that neurological guarding and try and just relax, getting into that stretch. So our breath work is 4 seconds breathing in and then 8 seconds breathing out. So your breath out should be twice as long as your breath in. That gets us into a rest and digest and a parasympathetic part of our nervous system. So remember, just really try and relax, focusing on that posterior pelvic tilt, finding the line of tension and holding that tension. Now let's go through our PAILs and RAILs cues. A PAILs contraction is going to be pushing my knee as hard as I can, best effort into the blocks. We're going to be scooping forward and up into hip flexion. Our RAILs contraction is going to be donkey kicking opposite way. We're going to make our knee lighter off the blocks. 15 seconds, best effort, safe contraction. I'm going to count you in about 5 seconds. 5, 4, 3, 2, 1, and drive that hip into the ground, scooping it up hard as you can. Keep going, keep going. 5, 4, 3, 2, 1. Opposite contraction, trying to make your knee lighter off the blocks. Really push hard for this one. This is the hardest contraction, can be a bit crampy. 3, 2, 1, and relax into that stretch. Posterior pelvic tilt, irradiate, switch on that core, find the line of tension. This is where we do our breath work and just let things go. 45 seconds here, and I'll count you in for another PAILs and RAILs contraction. Okay, 3, 2, 1, building up that tension, pushing into the blocks, scooping forward into hip flexion. Keep going, driving it as hard as you can, best effort. 3, 2, 1, opposite contraction. Try and lift your knee off the blocks. Keep going. Can be a bit crampy, this one. 3, 2, 1, and relax. 45 seconds. And just posterior pelvic tilt. Find the line of tension. Great, slowly coming out of this base. And what I want to do is remove a couple of the blocks so we can do our lift-offs. So staying in the same position, but what we want to do is we want to lift off and squeeze up. 10 reps. 2, 3, last rep will hold for 15 seconds. 4, 5. Really try and squeeze that extension. 7, 8, 9, and 10. We're going to hold for 15 seconds. Keep holding. Keep holding. 5, 4, 3, 2, 1, and slowly come out of this base. Let's go to the other side. So setting us up, resetting our timer on all fours, getting into our base, starting our timer. Find that line of tension, posterior pelvic tilt. When we're working in our end range, we're retraining the nervous system to help with our mobility health. We're retraining our nervous system, saying that it's safe for us to be here. We're strengthening in that area so the nervous system feels that it has strength to give you that range. And we're also stimulating what we call mechanoreceptors. So that allows you to have spatial awareness and active control and motor control through your motion and range of motion. So mobility health is having that active control through your full range of motion. And that's what we want to retrain, open up space and usable space for you to work with. Another 20 seconds, I'm going to count you in for our PAILs contraction. Best effort, safe contraction. We're going to be driving down into the blocks. Okay, 5 seconds to go. 3, 2, 1, driving into the blocks, scooping up and forward into hip flexion. Come on, best effort here. Keep going, keep going. 5, 4, 3, 2, 1. Opposite contraction. This is our crampy one, can be. Trying to make your knee lighter off the blocks. We're going into that donkey kick position. 3, 2, 1, and relax. 45-second stretch. Posterior pelvic tilt, and find the line of tension. So if that is a bit crampy, just back off that contraction in our rails contraction. And it's just because your nervous system, your muscles haven't had experience in contracting the muscles in that range, but that will get better over time as you retrain and get more usable space. Okay, 15 seconds. I'm going to count you in for another PAILs and RAILs contraction. Okay, 3, 2, 1, driving down into the block. To flexion of the hip, we're pushing and scooping forward. Really push hard here, come on. 3, 2, 1, opposite contraction. Trying to lift your hip, make it lighter off the blocks, donkey kick. Keep going, keep going. 5, 4, 3, 2, 1, and relax. Posterior pelvic tilt, find the line of tension. Okay, slowly come out of that base. Let's do our lift-offs. Really squeezing up into extension as high as we can on all fours, squeezing up into that hip extension. 1, 2, 3, 4, 5, 6, 7, 8, 9, and last one, 10, holding for 15 seconds. Keep holding. Keep holding. 5, 4, 3, 2, 1, and slowly come out of that base. Fantastic, guys. All right, hip CARs. Let's get into on all fours. We breathe in and irradiate. We come into hip flexion. We then go into abduction and internal rotation, searching for the best possible range, searching out for the movement that we have ownership over for just our hip joint. We don't want to be moving other areas of our spine to get this movement. So we don't want to be compensating. We just want to be moving this hip joint. So slow and controlled, searching for that space, creating the biggest circle possible. Good, going to hip flexion. We then internally rotate, abduct, search for that space, fight for internal rotation and extension, then going back into that neutral position. We then extend back, find that roadblock, then we externally rotate. Fight for external rotation. What space do you have ownership over? That's what we're asking. Great, we want to do 4 reps on this side and 4 reps on the other side. Great, last rep, going into flexion, abduction, internal rotate, fight for internal rotation as you're coming up. Try not to compensate through the back, going to extension, back into our neutral position. Into extension, find our roadblock. Now externally rotate that hip, fight for external rotation, coming up into flexion and into our neutral position. Okay, so let's do our other side. 4 reps on this side as well. Great. Breathing in and irradiating, coming up into flexion, abduction, internally rotate. Really search for that best possible space without compensating other areas of our body, especially our spine with this one. Great, just really slow and controlled. It's not how fast you do it. We just want to search for that space, get into that outer range. What movement do we have ownership over? Our CARs allows us to know it's the base or the foundational exercise for our hip. This is a representation of what the joint can do and gives us ideas of what we need to be working on and also our mobility health as well. Great, that's 4. Well done. Okay, capsular CARs, we want to lay on our back for this one. Bringing our leg up into that 90 degrees, our hip, and then we internally rotate and externally rotate. So just slow and controlled. Now we've opened up that space with the PAILs and RAILs contractions and stretch. We now just want to internally and externally rotate. Give our joint, capsule and nervous systems that information about that space that we've just opened up. Okay, last rep. Really try and squeeze out as much internal and external rotation as we can. We go to the other side. Again, internally and external rotation. Okay, last rep, squeezing out that internal and external rotation. Great. So we want to see how we pull up after our PAILs and RAILs contractions and when we're in those bases. If you're pulling up a little bit sore, we know we just want to decrease the intensity with the depth of the stretch and the intensity of the contraction. But if you're feeling great, then we know that we can go that extra level of intensity, and we want to go best effort, but safe contraction and safe intensity. So we just want to build this up over time. We want to get re-education, adaptation of those tissues. We want to get active control and better mobility. So let's give it a go.